Hey everyone, and welcome back to the channel. Today, we're tackling a topic that is incredibly important, one that could genuinely save a life, maybe even your own. We're talking about the warning signs of a heart attack. And here is something crucial to understand right from the start. Not every heart attack looks like what you see in the movies, that dramatic, chest-clutching collapse. The signs can be much more subtle, especially in women, and knowing what to look for is your best defense. Let's start with the most well-known symptom, chest discomfort. This isn't always a sharp, sudden pain. For many, it feels more like pressure, squeezing, fullness, or a heavy ache in the center of the chest. This feeling might last for more than a few minutes, or it might go away and then come back. It's a persistent discomfort that you shouldn't ignore. People often describe it as feeling like an elephant is sitting on their chest. If you feel anything like this, it's a major red flag. But the discomfort doesn't always stay in the chest. It can radiate or spread to other parts of your upper body. You might feel pain or discomfort in one or both arms, often the left arm, but it can be either. This pain can also travel to your back, neck, jaw, or even your stomach. Think about it, pain in your jaw or back might not immediately make you think heart attack, right? That's why it's so vital to be aware of this connection. If chest discomfort is accompanied by pain in these other areas, the alarm bells should be ringing loudly. Another key warning sign is shortness of breath. You might find yourself struggling to catch your breath, even if you haven't been exerting yourself. This can happen with or without chest discomfort. It might feel like you've just run a marathon when you've only walked up a short flight of stairs, or maybe you're just sitting on the couch. This feeling of being unable to get enough air is your body's way of signaling that your heart ain't getting enough oxygen-rich blood. Now, let's talk about some of the less classic symptoms, which are particularly important for women to recognize, although men can experience them too. These include breaking out in a cold sweat, nausea, or lightheadedness. You might suddenly feel dizzy, clammy, and sick to your stomach, almost like you have the flu. It's easy to dismiss these feelings as indigestion or just feeling a bit off. But if they appear suddenly and without a clear reason, especially in combination with other symptoms like chest pressure or shortness of breath, they could be signs of a heart attack. Extreme, unexplained fatigue is another symptom to watch out for. We all get tired, but this is different. This is a profound exhaustion that can come on suddenly or develop over days. You might feel so drained that you can't even do simple, everyday activities. For women, this can be one of the earliest and most prominent signs, sometimes appearing weeks before the actual heart attack event. It's a deep, unusual tiredness that you can't just sleep off. So, let's recap the main warning signs we've covered: chest discomfort, pressure, squeezing, or pain. Pain or discomfort in other areas of the upper body, like the arms, back, neck, jaw, or stomach. Shortness of breath, and other signs like a cold sweat, nausea, lightheadedness, and profound fatigue. It's also important to know that symptoms can vary greatly from person to person. You might not experience all of these signs. You might only have one or two. And as I mentioned, symptoms can be different for women than for men. Women are more likely to experience the less typical symptoms like shortness of breath, nausea, and back or jaw pain, sometimes without any obvious chest pressure at all. This is why many women unfortunately dismiss their symptoms, thinking it's just stress, anxiety, or indigestion. So, what should you do if you or someone you're with experiences any of these signs? The answer is simple and urgent: call for emergency medical help immediately. Do not wait. Don't try to tough it out or wait to see if the symptoms go away. And please, do not drive yourself to the hospital. Call an ambulance. Paramedics can start life-saving treatment on the way to the hospital, and they are trained to handle cardiac emergencies. Every minute counts when it comes to a heart attack. The sooner you get treatment, the more heart muscle can be saved. If you are concerned about your heart health, talk to your doctor. They can help you understand your personal risk factors, things like high blood pressure, high cholesterol, diabetes, and family history, and work with you on a plan to stay healthy. This might include lifestyle changes like a healthier diet, regular exercise, and quitting smoking. Prevention is always the best medicine, but knowing the warning signs is your crucial safety net. Please share this information with your friends, your family, your parents, your partners, everyone you care about. Having this knowledge is a powerful tool. It helps us look out for ourselves and for each other. It empowers us to act quickly and decisively in a crisis. You never know when this information could make all the difference. Thank you so much for watching and for taking the time to learn about this critical topic. Your health is your most valuable asset. Take care of yourselves and each other. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more content to help you live a healthier, happier life.